I think for me, practicing plastic surgery was never going to be just about treating patients. I'm not sure if that had something to do with the way I grew up in plastic surgery, with my father being a plastic surgeon, or just my experiences as a resident, but I never really saw a practice or a career as only treating patients. I sort of always saw it as teaching as being a part of that, of teaching residents, of teaching the next generation. And so to me, it's part of being a plastic surgeon is doing that as well as taking care of patients. I think the strengths of SIU plastic surgery are multiple. I think the mentorship model that we have is one of them. It's a situation where the residents shadow one faculty at a time, usually for a month at a time, sometimes longer. And I think that really helps the resident kind of see how that person practices. It gets them more comfortable with taking care of those patients because they have they see them preoperatively, they see them in the OR, they see them postoperatively. So they have a lot of continuity of care with the patients. They go to the OR in that situation, but they also go to clinic, and I think there's a real value to going to clinic, which I think other programs don't value as much, and so that's lost in some other programs, whereas here we do value the education that you get in clinic as well, and so that's something you see in that mentorship model. Other positives of the residency are the research opportunities. I mean, the research opportunities are immense, and they can be expanded on however the resident would like, meaning that they can, we want them to all be involved, but they can go way above and beyond being as involved as they would like to be. I mean, for instance, one of our residents was immensely important in starting our hand transplant program. He took a huge role in that and took that on himself because that's something he was interested in and wanted to do, and he was able to do that in this kind of an environment. I think as far as another pro of the residency is operative experience. The residents get an amazing operative experience as far as breadth of operations they get to do, but then also involvement in those operations. Once again, it's a continuation or progression, meaning that early on they're going to have a lot of guidance. They're going to have upper level residents or faculty showing them how to do things, allowing them to do small cases, but showing them what needs to be done. And then as they progress through the residency, they're going to have more and more autonomy to eventually, at the point where they're a chief resident, they could be doing the cases themselves with the faculty just assisting them, if they're capable of that. So I think that exposure, and that includes all surgeries. It's not just a couple cases you can do by yourself, but all the cosmetic surgeries still the faculty does. That's not necessarily the case. If you're a competent chief resident, you could be doing any of the cases that we do, any of the surgeries that we do. So at SIU, we have had quite a few female residents throughout the years. I think when we looked at the numbers, we have trained, for the numbers of total residents that we have trained the largest percentage of female residents. And it's not been a situation where we've chosen them just because they're female. It's been a situation where we choose the best residents that we feel as they come through on the interview trail. So I think it's a situation where Dr. Zook, who started the program, has just always been very supportive of having females in the profession, feeling that they were as equal as the males, not superior, just as equal, and that they should be given a chance as well as the males to become plastic surgeons. So I think he's always been a big proponent of that, and I think it reflects in the number of females that we've had come through here. It's a family, and it's a family not just when you're here, but it's a family when you leave, meaning that you can always feel comfortable calling back to talk to one of the faculty members. Always feel comfortable if you have a problem or concern, giving any one of us a call, and we'll be more than willing to talk to you and help you walk you through something if you have an issue. It's not even just a situation of residents calling back and talking to us. Sometimes there are situations where previous residents call back with a question and it's not something we can answer, but we can get in touch with another former resident who can answer it, who can help them. And the other former residents are just as willing to talk to residents they've never even met before, but they know they're part of the SIU program. So there's a lot of back and forth in that respect. I mean, we even have some older residents or older former residents who have, contacted us and helped us change our own practice. I mean, an example of that is J.B. Moore, who contacted me a couple of years ago to talk about migraine surgery because it was something he was doing and we weren't. And since then, we've developed a migraine surgery clinic, and it was all because of a former resident who loved SIU enough and thought it's something that we should be doing here, to contact us and to make an effort to educate us on, his findings on it and how it's helped his patients, and how happy he's been that he's been able to incorporate that into his practice, and then bring that back to his institution and teach us.